Foot problems come in many sizes and shapes and are frequently annoying enough to interrupt one's daily life. Oftentimes, an individual with a painful corn, callus, or bunion will seek the attention of a foot specialist in the hopes of alleviating the problem. A current method of approach receiving increased interest and popularity is that of minimal incision surgery. This technique, which utilizes minimal incisions and reduced soft tissue work, is also meeting wide acceptance in other operative specialties, such as orthopedics, gynecology, and ophthalmology. The procedure itself is performed painlessly in the office with the patient able to walk immediately. There is usually much less disability time, decreased post-operative discomfort, and frequently less interruption in one's daily routines with this approach. Minimal incision surgery, however, is not a panacea or cure-all for the foot ills of mankind. A foot specialist trained in this operative technique, along with careful case selection, form a necessary formula for success. Minimal incision surgery is in essence just what its name implies. Comparatively small incisions made in the skin through which an electrically powered burr or drill is introduced for the purposes of filing, remodeling, or cutting a bony surface. Although this description sounds far from pleasant, the procedure itself is painless due to local anesthesia. The smaller incision and relative absence of extensive soft tissue dissection are the primary factors differentiating this technique from the more traditional forms of foot surgery. This surgical technique will most often be used in three major areas. The first on a corn, which can occur on the outer portion of the digit or between the two toes. These thickened accumulations of skin can become most annoying as well as cosmetically displeasing. The inability to wear one's shoes comfortably, the need for periodic routine care, and the progressive level of discomfort make this seemingly innocuous lesion a real problem. Unlike its traditional counterpart, the minimal incision approach involves a very small skin incision, which in most cases is no greater than 1/8 to 1/4 of an inch. The bony surface underlying the lesion site is then filed down in order to create a sort of concavity. Although guarantees cannot be given in relation to the outcome of any surgery, cases of this type statistically seem to respond well. After surgery, a small compressive dressing is applied, allowing the patient to immediately wear her own shoe and return to work in a day or two. Regular bathing is allowed and encouraged in about 1 week's time or less, as opposed to former procedures which removed large sections of bone, causing pain, swelling, and lengthy periods of disability. The minimal incision approach is indeed an improvement. Calluses beneath the ball of the foot comprise the second category of cases where this technique is used. The worst of the group are the deep-seated cores, or punctate type of calluses, in which a wrong step can drive a person up the wall with pain. In a sense, these lesions are like corns, which are merely located on the bottom of the foot. The underlying cause is often a metatarsal, or long bone, which is at a lower level than it should be. The result is excessive pressure beneath a particular metatarsal bone, and thus a callus forms. If allowed to progress without treatment, these lesions will often become worse and even begin to involve a neighboring bony site. The most current and acceptable method of possible correction for this annoying problem is to move the metatarsal bone upwards to a more adequate functional position. In order to accomplish this, the metatarsal bone must be surgically fractured, but in an absolutely painless manner due to the numbing effect of a local anesthetic. With the minimal incision technique, a small skin incision is made at a designated area of the foot. A power burr or file is then used to create the necessary cut in the bone, thus allowing the metatarsal to move up as it should. Only 1 or 2 skin sutures are needed, and the entire procedure is usually completed within a few minutes. A small dressing is applied. The patient is usually able to put on a regular shoe and allowed to bathe during the second week after surgery. For post-operative pain, the vast majority of patients are advised to take only aspirin or like substitutes when needed. The last, and in some ways most remarkable application of this procedure is in bunion surgery. Not all bunions can be approached with minimal incision surgery, but when experience and careful judgment is exercised, proper case selection can be made. The procedure involves a filing of the prominent bunion bump along with the straightening of the large toe. As mentioned before, very small incisions are used to minimize post-operative discomfort and scarring. During the procedure, often an X-ray is taken to evaluate the correction of the bunion. Patients seem to do much better with minimal incision surgery. They experience less pain, reduced disability, and a more rapid return to their daily routines. Corrective bunion surgery utilizing this technique is a far cry from its traditional counterpart. The concept of minimal incision surgery is a relatively new and promising area of operative podiatric medicine. Minimal incision surgery is not the only method nor the answer to all surgical problems, but it is an operative approach which more adequately satisfies some of the frequently raised patient complaints. In short, this procedure may make possible a corrective approach involving little to no discomfort and very little interruption in one's daily routine. It may not always be necessary to stay in a hospital for those procedures, which can be performed in the office. The results thus far are extremely encouraging, and the patient response quite exciting. Minimal incision surgery is a concept and technique which, when utilized by an experienced podiatric surgeon, can produce some very satisfying results.